Hello everyone, welcome to Spotters and Boosters edition 15, and here we will learn something about ATCOM competence. The questions given for SDL in the previous edition is part 1. Which one of the following ATCOM attributes is depicted in the image? The answer is compassion. Compassion is a concern for and intention to help, denotes a good human behavior. It includes principle of beneficence and justice. It includes awareness, sympathy, empathy, and responsiveness. So these attributes are so important in developing IMG. Compassion, sympathy, and empathy are interrelated in some way, in a degree. Sympathy is one way, expression of, but not sharing. Whereas empathy is expression of feeling with sharing. And that is as if it is own. Now, example is sympathy. Many felt sympathy for a parentless child. Now, look here, there is no association. Thereafter, the expression is terminated. Whereas in empathy, having faced such a situation, he had empathy for his friend who got stuck in traffic jam, depriving him an opportunity to appear in a job interview. So now he is feeling as if it has happened with him. Now let us focus on ATCOM module 2.8 in this session. What does it mean to be a family member of a sick? And in short, notes could be in the form of role of doctors in community and expectation of society from the doctors. Question B could be, what is empathy and what is the role of empathy in care of the patients? Now I'll just focus on 2 hours of self-directed learning. Others will be done during training. What does it mean to be a family member of a sick? Now here is a case study. An unmarried male, 36 years of age, took care of his ailing mother who suffered from heart disease. He regularly brought her for monthly checkup in a tertiary care hospital situated 50 kilometers away from his home. He worked in a private firm which deducted wages for days he took leave for his mother's care. One day, while returning from a regular checkup, mother fell down from auto rickshaw and sustained head injury that required hospitalizations and further investigation. Since such facilities were not available nearby, he brought her unconscious in a tertiary care private hospital where MRI and CT scans revealed intracerebral bleeding with hematoma. By that time, she became more unconscious, deeply unconscious, and developed respiratory difficulty and was intubated and put on medication. The daily hospital expenditure was high and no concession was offered, but he could not afford this costly treatment, so took loan and aid from relatives to save his mother. As days passed, his financial condition worsened and he had to shift her to a nearby district government hospital where ventilator was available. Despite his best he could do, the mother succumbed to head injury after a month of treatment. Drained financially and emotionally, he broke into tears and was assisted by relatives for cremation with rituals. Now, after going through this case, what does it mean to be a family member of sick? You must have realized. And once you have realized and felt, you have developed what is known as empathy. How could one express his feelings with him as a relative or as a doctor? What does it mean to be a family member? It means a lot. Attending hospitalized mother for daily routine and care, huge daily out-of-pocket expenditure, buying medicines, food, frequent traveling, and ignoring daily chores and personal needs, absence from duty, So there is loss of the wage earning man nowadays. Physical and emotional stress due to expected poor recovery, fear of losing mother, leaving him alone, depletion of financial resources, loss of job. So would you sympathize or empathize? Sympathy is the expression of a pity or sadness for patient without understanding much about emotions and situation. It is a one-way message that creates dissociation and termination. Empathy is much more than sympathy, and feeling someone suffering as if own. It has great emotional connectedness and is not dissociative but is inclusive. It creates a sense of how to help the other or sufferer. Develop compassion by empathizing. Empathy helps doctors to look beyond medicine to humanities, leading to equanimity in. Now, expression of sympathy is important. Empathy is about being aware of patients and family members' emotions and understanding their situation, feeling, and perspective. So it can be emotional empathy, cognitive empathy leading to compassionate behavior. Empathy is integral to express gratitude, kindness, compassion. We can be fair and just only when we get connected emotionally with others. A doctor would offer compassionate care when he is empathetic. It can be expressed in many ways: active listening, communicating in empathetic words, acknowledging and sharing concerns, and using non-verbal clues along with language, that is body language, putting a warm hand on shoe, huh? taking the hand in, uh, taking patient's hand in own hands, and this is how we can express our concern. But no, second part is the role of doctors in the community and expectations of society from the doctors. A doctor plays a larger role in society. Despite grudges and litigations, the doctors are the most respected professionals in society even today due to competence and hard work and humanitarian approach to the sick. Is also due to self-regulated behavior. Doctors follow values, norms, and morals. Even government regulations are being earnestly followed. As a healthcare provider, is the doctors work in the best interest of the patient for treatment, prevention, promotion. Now, as a healthcare manager, doctors are involved in allocation of services and resources equitably as a leadership role in managing health during natural or man-made calamities. The doctors have role to play as the advocacy and health education, promotion of ethical values, behavioral changes by mass education, environmental protection is done this way. Doctors can represent society on behalf of them for provision of better healthcare facilities and preserving human dignity and autonomy in the groups. Doctors are also role models to shape the careers of aspiring young, excellent because of their exemplary behavior and demeanor. What are the expectations of society from doctors? Competence and trustworthiness, provision of equitable health care, communication, ethical and empathic behavior, cost consciousness, and easy access, availability at the time of need. What are the issues involved in this? There is a conflict between societal expectations and doctors' responsibility. Personal moral beliefs of doctor may differ from that of society or individual patient. Doctors can act as a gatekeeper. They may not agree to the unwanted demands from the patients. Uh, there is another issue of contentious objection. Doctor may refuse medical termination of pregnancy when there is no indication. Doctors have dual loyalty, loyal to patient and loyal to police, government, insurance, corporate hospital. Therefore, there are issues of confidentiality breakage. Workplace dilemmas are many. Apart from ethical dilemmas, working hours, leave, remuneration, they are also causing a lot of the issues. Family care versus community care. How much time to be given to family? Personal care is often ignored by doctors. Earning versus benevolence. Where not to take money? And self-health. I told you, mostly ignored health. Managing time is very important, and long hours result in burnout and emotional drainage. So this is all about competency 2.8. Now homework for another competency of PETCOM, that is competency number 2.3, that we will discuss in next episode. Till such time,